I went to my department head when I got lab results that said I was in premature ovarian failure. I was told, without knowing it was due to a pituitary tumor causing that amenorrhea, that it was likely stress-induced hypothalamic amenorrhea. And I went right over to the office and interrupted his day in tears and said, I cannot do this residency program anymore. I had so much self-hatred about this because you think, why can't I hack it? Why is this me? Why is everybody else doing fine? What is my problem? Why can't I do what everybody else is doing?
Welcome, everyone. This is Dr. Moss from MedPsych Moss, and I'm so excited and honored to interview Dr. Dawn Baker, who is a physician, writer, speaker, and lifestyle design coach. She helps other physicians and professionals step off the treadmill of achievement, rediscover their true selves, and cultivate a practice of balance. She's the author of Lean Out, a professional women's guide to finding authentic work-life balance. Is also a certified yoga and meditation instructor who is passionate about off-grid living, homeschooling, fitness, and travel. Thank you so much for being here, Dr. Baker.
Oh, thank you so much for having me on your podcast. I love that you're doing this show.
Thank you. Something that I didn't see on the bio is your podcast. What is the name of your podcast so I can include that?
Yeah, it's easy because it's similar to my book. It's Lean Out. That's the name of the podcast. So you just have to look for Lean Out with Dawn Baker.
Love it. And we'll touch on that a bit later. But I wanted to put that in the bio now that we had just mentioned it. Going back, I would love to hear about your journey into medicine.
Yeah, I actually was an engineer before I went into medicine. My young adult life was spent, like a lot of people in medicine, achieving and studying super hard. And I thought I wanted to be an engineer. And then I met my husband and we started rock climbing. And this changed my perspective on life. I met people that were doing jobs in a more free way. They were able to travel, and I didn't see that as something I could do as an engineer. Engineering really pegs you to be in a specific geographic place. So I studied chemical engineering, and you end up going into biotech or petrochemicals. And so that means you're going to live in Texas or you're going to live in California, pretty much. It really pegs you geographically. At my core, early on, I wanted freedom in my life, whatever that means. Financial freedom, location freedom, time freedom. I traveled a lot for rock climbing, and it changed what I wanted to do with my life. We were on a trip one time in Nepal and Thailand, and I decided that I wanted to do something more service-oriented. But I had no role models in medicine at all. Like, I had no family members that had gone into medicine. I had no friends of my parents that were doctors or anything like that. When I told my parents I was going to medical school, they thought I was strange. I worked as an engineer for a few years, and then I didn't have too many things to do to make up and get into medical school. Ended up going to medical school, and I really loved it. I thrived on the new learning. I loved learning new things. I really loved the wards. It was hard to get used to the test taking. It was different than engineering. Then I went to residency. And in residency, things started to change a little bit. I started to experience what I considered to be burnout. And at the time, this is maybe late 2000s, around 2010, people were just starting to talk about burnout. It wasn't a thing that was even really mentioned. Work-hour restrictions had just come on the board a few years before that. I felt an anhedonic depression. I felt like it was very difficult for me to get out of bed in the morning. I was having sleep disturbance. I was gaining weight. I had a lot of non-specific symptoms. And because I was a non-traditional student, a little bit older, and at the same time was married, decided that we probably wanted to start a family, but I hadn't had a period in over a year. And it was something I was ignoring. I was thinking like, oh, it's just stress. All of these things that I was experiencing seemed to be something that you could chalk up to stress and burnout. At the same time, I was having difficulty. I'm an anesthesiologist, so a very procedure heavy specialty. I was having difficulty performing some of the procedures that we have to learn, specifically things that involve using an ultrasound and then guiding a needle based on where the ultrasound image is. Some of my attendings were like, what is wrong with you? Why do you not get this? Why are you having problems? I started to have some interpersonal strife with people at work. Long story short, I went on a diagnostic odyssey. It involved taking FMLA time. It was ultimately culminated in a diagnosis of a very large pituitary tumor, and it needed to be removed immediately. It was causing compression of my optic nerve and profound vision loss, which I personally hadn't even recognized. So I underwent surgery in 2000 and under the care of people that were supervising me in my residency program, and had a convalescent period, a little bit more time off, and then finished my residency and became an anesthesiologist.
Oh my goodness, what a journey. And thank you so much for sharing the realities and the ups and downs that you experienced. And I'm so sorry that it went so long for a diagnosis.
I'm
Very
sorry
sad.
too, because it was really, some of it was my own doing. I was ignoring my symptoms. I was trying to be everything to everyone. Just like a lot of us in the achievement culture and in medicine want to do. We want to be the best at everything. In this time period, I got really excited about a particular niche specialty in anesthesiology. Because I had this engineering background, people were telling me, oh, you're so good at this transesophageal echo interpretation, you understand the ultrasound and all that stuff. It wasn't the procedural part, it was related to equations and doing calculations. So I got pegged as the next golden child in that area. And it's funny because if I had gone down that way and I hadn't had this health scare to wake me up to what my original vision was, which was to have more freedom in my life and to do something that involved all of these different aspects of freedom, I would have gone down that same path that I was going down as an engineer, of being in a very specialty field, being pegged to be working in a city center, at an academic center. So I'm really honestly glad that this happened to me. I'm very lucky in that I didn't have a malignant brain tumor. I had something that was removable, that is treatable, that I have to take medications for now, but that is really not that hard to deal with. At the time, it felt horrible, but there are a lot of perspective now that makes me realize that I'm very grateful for everything that happened.
Thank you. That is really helpful to hear both sides of the before diagnosis and how I think that's something that maybe I talk a lot in my own experience because I was diagnosed during medical school, but it's really good to hear about the things farther on of in the future of able to get back to things you love, even when health scares or different challenges of residency come in, you're able to still find yourself and what you're most passionate about, keep going. It's really inspiring to hear that.
Yeah, and I think one thing that is challenging about this is that a lot of us really don't build in breaks, and we don't really have breaks in our normal schedule. I was forced to have some of these breaks, and that was what helped me to get perspective. When you have downtime, and I tell this to my coaching clients all the time, when you have alone time, that's when you get the perspective that you need. You get that time where you can be like, what do I really want? Am I on the path that I really want to be on? You don't have to get to the point where you get sick and you are forced to take a leave or forced to take time off because you're not doing well and you can't work.
That's such a good point. That's something I've started to talk a lot about how individuals with health conditions do seem to be taking these breaks. I took a leave of absence between my second and third year of medical school, and I had to really think about what is most important to me. Do I want to even continue medicine? Can I even continue medicine? So I very much appreciate that thought period. You said you took FMLA. I've talked to some residents, but it's still challenging to hear of going disability route versus FMLA, a combo of both. Was that an option for you when you were in that position?
That wasn't something that was even presented to me, maybe because of not actually knowing what was wrong with me at the time. I went to my department head, and I think this is going to be program specific and department specific. I went to my department head when I got lab results that said I was in premature ovarian failure. I was told, without knowing it was due to a pituitary tumor causing that amenorrhea, that it was likely stress-induced hypothalamic amenorrhea. And I went right over to the office and interrupted his day in tears and said, I cannot do this residency program anymore. This is not worth it to me. I am not able to start a family because of the stress that I'm undergoing. In the same time period, I had so much self-hatred about this because you think, why can't I hack it? Why is this me? Why is everybody else doing fine? What is my problem? Why can't I do what everybody else is doing? I went and luckily I had a very gracious department chair and program director that said, don't quit, take FMLA for a few months. So that was what I did. I didn't even look at doing disability because it was really more at that time something that we didn't know there was a physical organic component to it at all. It was one of those things where it was like stress and burnout, and this is causing this health manifestation, but there wasn't a very specific diagnosis.
No, I understand that. And I think something that you said that really resonated, which I think will resonate with a lot of listeners, is this two things. One, of any type of physical manifestations only being from stress or only being a mental health component. Even though I'm going to be a psychiatrist, I very much recognize the mental health component having manifestations on the health, but that doesn't mean that isn't real and that physical manifestations that are medical won't come out. And also the self-hatred, the feeling of being very alone and separating oneself of why can't I be like the rest of the people is a struggle that a lot of us with health conditions have in medicine, where we're supposed to be the perfect performers, like you said, high achieving, almost inhuman to some extent, not have any challenges.
Yeah, there are so many physical ailments where people walk around with them and they're not manifesting in a way that you can really see. The same with mental health problems. That is tough because even as doctors, we all have our biases. And you see someone and you think they look fine. They're walking around, they're not in a wheelchair. It's not like that. There are a lot of things that people walk around with and you don't even know.
So true. Those invisible or non-seen disabilities is definitely something that we need to talk more about, because it's definitely something that a lot of individuals feel very alone with, because it's not something everyone else can physically see.
Right.
You spoke a lot about your challenges in residency. What about when you got out of residency and moved on to attending? How did your medicine career change, or how did that go for you?
Yeah. So when I had my diagnosis and a prolonged period of convalescence after that, I really had time to think about what I really want. On the promptings of my husband, he was like, please don't do a fellowship. Just get done with residency. Before I was even diagnosed, I was like, I think I want to quit. I think I am done. And he would be like, you only have another year, or you only have this much. Just get that certificate, and then you can figure out what you want to do. And I think that was good advice. The thing that I realized as I had my time to myself was that I had forgotten my original vision, which was that I wanted to have that time freedom, that location freedom. I decided in that period that I wasn't going to do a fellowship. I was going to get finished and find a job. I would try to find a part-time job. I always wanted work-life balance. I always cared about doing my personal things, my rock climbing, my travel, whatever else. I wanted to have a family, but I was open to lots of different possibilities. And so I basically took it one step at a time. It was, let's take a 6-month chunk and just work there. And so it was like, all right, let's get healthy and then finish my last 6 months of residency without having any medical issues. Let's survive that. I did start looking for jobs, but it wasn't like I wasn't trying too hard. I was trying to be gentle on myself. I actually, ironically, ended up working at the same institution where I trained. And the reason I took a job there was that there was just the right opportunity for me that happened to come up at that exact time. They introduced a non-teaching track that was purely clinical in the anesthesiology department. I took that job and milked that job for all it could be for 10 years. And it was perfect for me. I was in a familiar place, I had the acuity of patients that I was used to and that I liked, but I also I could focus on just clinical work. I didn't have to have all of the roles of an academician. I did not have to do research. I only taught sometimes when they needed an extra person. I did not have to take call. I never went out and said, I'm not going to take call, but it is hard for me to take call because I have hypopituitarism. In the middle of the night was the time when I would need to maybe take extra steroids if I was awake all night. Normally, when I sleep, I'm fine, but you just have to worry about fainting, your blood pressure staying stable, and your blood sugar staying stable. So I take medications every day, basically, of my life since I've had this procedure. But that doesn't mean I can't do call. It's just that this job opportunity came up that didn't have call. And I was like, this is perfect for me. 3 days a week, they guaranteed me a schedule. But I was super reticent to take the job because of my relationship or my reputation in the department. An attending that I felt was a mentor, someone I trusted, I disclosed this to that person. And I said, everybody thinks I'm the sick person, the one who had this problem. I'm the black sheep that was in this residency class or whatever. And he was like, you're going to be an attending. You're not going to work with the other attendings. You're going to be in your own room, taking care of your own patients. They have nothing to do with your practice anymore. They're in the same department, but he was like, you're just working parallel with them. And this is not the same with every single specialty, but with anesthesiology, we work by ourselves. I was like, oh, yeah, I didn't think about that. I was still in that residency mode and med school mode of what does everybody think of me and what are my evaluations going to be? But you get out and you're an attending, no one's evaluating you. No other department people are evaluating you. Maybe one, but you might have a faculty mentor or something like that. So that was what I started to do. And I will also mention, just since we talk about being a patient and disability and things like that, that I then, in order to start the family that I had dreamed of, I then became a patient again as an attending, as it became an infertility patient. And so that started the whole being a doctor as a patient cycle again. But it was all right. You have a little more agency when you're in attending than you do when you're a resident. And I did what I needed to do, took the vacation that I needed to take, tried to give as much notice as possible. It is very difficult. Infertility is something that's really difficult to navigate because you don't know ahead of time, I'm going to have this procedure in 2 weeks. You don't know that. You don't know what day it's going to be. So that's really difficult. But it worked out okay. I did have a child. I have one kid, and I have transitioned out of that job for freedom purposes. We wanted to move to a different location. Now I do PRN anesthesiology.
Wow, that's incredible. Thank you so much for sharing that. And I very much resonate with the infertility. Is something that I talk a lot about on the first couple of episodes that I did, because I also went through infertility with my diagnosis. I had to do IVF to freeze embryos and all that. It's something that we've talked about before, just how difficult it is to do those procedures when things come up. You have to go into an ultrasound randomly or get some more meds or blood draws. It's not as flexible, especially if you're working as a physician. It's really hard. I'm glad you brought that up. One of the doctors, Dr. Marshall, she's the head of the infertility AMWA awareness, and we found that 1 in 4 women physicians have infertility. It's a lot, not just with known health conditions, but just with all that happens in medicine, all the stress, like you said, the older age, there's so many factors. So this is a conversation that we definitely need to have more, is just this reality that can happen to a lot of us.
Yes, I know who you're talking about, Ariane.
Yes.
Yeah, started going down the rabbit hole of looking at these statistics as well. And I'm glad you brought this up because you and I had very particularly defined medical issues for having infertility. And that almost makes it a little bit easier mentally to understand. There are so many people who have unexplained fertility or multifactorial fertility. And it's not something that many people know about, but that women in high octane professions like medicine, and then it's becoming more known in law. There's more data in medicine that it's more than double the rate of the general population. And there are multiple different factors. We don't even really know all of the factors yet. There's not enough research on that. And my book, Lean Out, is one of the only books that addresses this issue. I talk about it because I talk about how the achievement culture is costing women professionals, but also men, their health, sanity, and fertility. It's just not something that's talked about very much because it's one of those taboo issues like the invisible illnesses you're referring to.
Oh, yes. And as you're saying that, we were talking before how I got in contact with you. I'm wondering if Dr. Marshall referred me to you. I interviewed her. We wrote an article together on our individual infertility, both as her when she was like a resident fellow and me as a medical student. I'll make sure to include your book because that is so helpful to hear. You shared your experience. Like you said, it isn't talked about. And I would say infertility is one of those invisible disabilities that a lot of people maybe don't recognize they have until they're actively trying and are
Yeah.
unable to do it, to have a child.
Yeah.
You talked about this a lot, but I'm wondering from now a physician perspective, how has the experience of being a patient in all these different capacities impacted how you interact with patients?
Because I'm an anesthesiologist, I have a very defined period of patient interaction. It's a little less open than a primary care physician, OBGYN, for example. But at the same time, it's funny because I think that our patient interaction is very under-recognized. You have a very specific, very small period of time that you have to get someone to trust you, to trust with your life, basically. And that takes a very specific skill. I have really learned to hone that over my years of practice, and I really revel in it. I love that interaction. I really love making good first impressions. It's something that I've always cared about, even with just surgeons. Now, when I do PRN travel physician, it's funny because I always love a day when there's a grumpy surgeon and then you start working with them and then they're like, "Oh, I really like you." They don't say that, but you're like, "Oh, thank you so much." Or they start to warm up. It's just funny. So getting a patient to warm up to me too, I really love that. One of the things that I do is that I sometimes, if it's necessary, do disclose personal information. And I think that not all physicians do that, such as someone is super nervous about surgery and I will offer a little tidbit like, yeah, I've had surgery too, and it's very scary. We understand that this is a big deal to you. I like to also say to people, this is a very big day for you, but for us, this is every day of work. We're going to take good care of you. We do this every day, even though we know you don't do it every day. So I really acknowledge the gravity of the day for people. I will sometimes, not too detailed, but just mention something about my experience having had surgery. I don't usually talk about the specifics, but I think it really endears patients to you. It makes you seem human. Not everybody feels that it's professional. However, I think it can be within the realm of professionalism to share some parts of your personal life or your personality to patients.
I love that. I completely agree with you. I really like how you were very intentional, really
Mm.
intentional with how in during this time period, I say this amount and this is the benefit. You're not just spurring all these different facts and content. I think that's where individuals get in the professionalism type thing, get scared, but it's so important to showcase that you can be professional and a physician and how beneficial it is to just show that little sliver of humanity, of similarity, of showing that you are human just like them and you're still going to take care of them. You recognize their emotional experience of fear and that you've experienced that too. I can just think back at myself going into surgery and how fearful I was. If I had an anesthesiologist that similarly shared that, it definitely, like, I felt it would have been so comforting.
And along these lines, I didn't mention that for 5 years, I really missed this part of my work at the university. I did infertility anesthesia. I was one of the main people that got a contract with the nearby fertility clinic to do office-based anesthesia. I was like, yes, sign me up. I want to be there. And the people that I was working with were people that had treated me. And they all knew me. I was their favorite anesthesiologist when I would come. I would go as much as possible. I would get up at 5 in the morning to do this before the OR because it meant that much to me. They would do them like because the other BGYNs sometimes they would have OR days or they would have full clinic days. So they would do the procedure starting at 6 in the morning. And I loved it so much. I always would tell the women that were getting their egg retrievals, I had this done. And I have a picture of my child and I would show it to them. I would say, look, this is what I got. This is going to happen for you. People would cry. I would cry with them. I just think it was good for me, but it was also good for them because I could turn around my experience and help other people. So I had forgotten about that experience. It's been a few years since I did that. I do miss that quite a bit.
Oh, I'm tearing up just thinking about that. And I'm so glad you had that opportunity. I'm sure
Me
that
too.
was so meaningful for both you and the patient. How amazing experience, I'm sure. What are your thoughts on going? I know that you've moved a little bit away from academic medicine, but even in non-academic medicine, what are your thoughts on really emphasizing humanism and breaking stereotypes in medicine?
My thoughts are that I welcome it. I think it's wonderful. We need to build more into our academic programs, but just in general, our culture of medicine, flexibility, and humanity. For example, infertility, unseen illnesses, mental illness are just like someone who gets a cancer diagnosis. And if your colleague or your student or your resident gets that diagnosis, what are you going to do? Be like, sorry, you're out of the program, or you got to take a year off and then come back and repeat everything. You're going to work with that person. There is such a range of things that people are experiencing nowadays, especially in modern society. We've got this modern society, and people are getting sickness and autoimmunity and infertility that we can't fully understand, but we need to embrace. I think that it's very important that program directors and medical school faculty need to be addressing and thinking about this when we're going through and we're trying to instill that culture in our students as they come up and train.
I love that flexibility and emphasizing humanity. As we start to close off, I know that you're also a life coach. I would love to hear any final pearls of wisdom or advice you provide to other individuals, especially health professionals who are living with health conditions.
I definitely feel like whether you have a health condition or you don't have a health condition, you don't have to wait for a catastrophe to take stock of your own personal values and learn more about yourself. In the limited time we have in our busy schedules, you can still find time to do this. I was even just coaching someone yesterday about using their commute to have mindfulness exercises and not just talk on the phone or listen to music or listen to the news, which is even worse. I was like, hey, you can do these breathing exercises, or you can just sit in silence. If your commute's 45 minutes, even just try 10 minutes of it and see what you can do. Spending time by ourselves, thinking about the things that you used to do before medicine or the interests that you have, the values that you have, remember those things is really key for your success as a doctor, but then later as all of the roles that you lead, your personal roles, your spouse, your parent, leader in a community. Spend that time to remember those things. In my book, I have a lot of exercises for people that are very simple to do. So if you look in there, you can find in the second half of the book lots of exercises throughout the book, but there is a lot of information in the second half that really applies to men and women, people who have pre-existing health issues and people who do not, to learn how to be authentic in your work-life balance and figure out what you really want.
That is wonderful. Thank you so much. I'll make sure to include the book. And I'm wondering, have you created an audiobook yet? I've been getting into those, especially as I have an hour commute to residency. You have created one?
Yeah, so it's available in paperback on Amazon right now. It's print on demand. Paperback, Kindle, or audiobook is there. It took me a while to record the audiobook. I
Oh,
had to
yes.
really sit down and figure that out. I ended up having to hire somebody to help me make it sound good, but it's there. You can get it any way that you want. You can hear inspirational stories. Some are originally from the book in the very first episodes, and more interviews with women professionals. I even have interviewed one man so far on my podcast, Lean Out.
Thank you. I'll make sure to also include that podcast as we're talking about being able to connect with you and learn more from you. Do you have any other resources or ways that individuals can connect with you if they want?
Oh, yeah, of course. So I have a website that has long-standing blog posts. I started blogging when I was at the end of residency and experienced this health crisis. There are 10 plus years of blog posts on my website and other resources, information about my book and my podcast. It's called practicebalance.com. That's the name of my company, Practice Balance. You can find me most actively on Instagram for social media, and my handle is Practice Balance.
Amazing. Thank you. I'll make sure to include the practice balance. And I'm so excited to start reading your blog. In addition to your book, I started reading the book last night, which I just got the intro. I was like, oh, I'm so excited to interview her now. I also started blogging in medical school during my diagnosis, writing and being able to express all those challenges through writing and sharing it with others is so meaningful. So I'm glad that we have that in common.
Hopefully someday you'll write a book as well. It's a really great experience. I loved it.
That's definitely my dream right now. Working hard to only do one project at a time, because my problem is I
Yeah.
start doing this and this and this. So I'm like, okay, before medical school, before residency, podcast only. Even though I start a little bit writing my book, I'm like, no, podcast, one thing at a time.
You have time.
Yes, thank you. Yes, there is time in the future. Thank you, Dr. Baker. It was wonderful speaking with you today. And thank you to everyone who is listening. I like to always let everyone know that you are not alone in your experience. I hope that these podcast episodes really are a form of inspiration to know that individuals can struggle with invisible disabilities or just life and able to come back from them, able to keep going while living with these challenges and even achieve their dream and be successful. And so thank you so much. I really hope that can help others. If these stories are meaningful to you, please subscribe and share them with just one other person that you think might help, because that's how we build a community of individuals who can fight these taboos and stereotypes and show the humanity in medicine. You can see more of my own blogs and all the things that I have at medpsychmoss.com, and you can find me on social media at medpsychmoss. Lastly, thank you, Dr. Baker, and I look forward to seeing more of your journey in the future and reading more of your work.
Thanks.
Thank you. Take care.